Ben Greenfield. I am an assistant professor in the public health program. I teach both master's classes and undergraduate classes. And so the masters of public health students range a lot, but a lot of them are working people in either in some kind of health-related field or who are interested in health. I want all the students come out of my class to be able to process some data in a spreadsheet, be able to interpret numbers, be able to look at scientific research. People in the public health field will do things like, roll out vaccine programs for COVID or other infectious diseases. People will do things like test houses for lead, properties in houses, like old house, run programs testing babies and young children for lead levels in their blood, design programs to reduce things like the amount that high school students vape and smoke, look at patterns of health problems and issues like things like cancer, school shootings, for example. All of these types of things, having a background or a public health background is really useful in terms of different principles and approaches to study these different problems and solve them.